Hello, thank you for joining our leadership session today. We'd like to welcome you. My name is Michelle Kraft, and I'm the Director of Business Relations for Iowa Vocational Rehabilitation Services and a committee member of this breakout session. I will be facilitating this session today, and I am a white woman wearing a white shirt with my background being pink and gold polka dotted wall. My pronouns are her and she. You are in the leadership session, and we're excited to hear from our business partners in various career sectors about their innovative and successful practices to being an inclusive workplace for people with disabilities. And I have a great pleasure and honor to introduce you today to Dan from Mercy, Kyle from CMP, and Jordan from Quick Trip. I'm going to start with you, Kyle. Could you introduce yourself? Tell us a little bit about your organization. What's your personal connection to inclusion in the workplace? And really, what is your business why?
Absolutely. Thank you for the opportunity to attend and speak to everybody today. Really looking forward to the conversation. So I am a white male wearing a striped blue polo shirt, sitting in my office, which is not very exciting, but there's a couple cabinets behind me. My pronouns are he and him. So I call myself an accidental inclusionist, and my role with CPM is the Vice President of Human Resources. We're a global organization, and we have individuals in 11 different countries and 26 different locations. So inclusion is part of the core of my job. And I got involved in it as it relates to specifically workforce and the challenge hiring and retaining talent within my organizations. And as I was going through the challenge of trying to find great people and keep great people, what continued to pop up in front of my employees was barriers to success. And as I learned about the community that I work in, which is Waterloo Cedar Falls, I learned that there were many systemic barriers in the way for people's success. And some of those barriers were things that an employer could actually help with. And so it came from a very simple place of how do we knock down some of these barriers? So things like transportation needs, individuals who just need some minor accommodations to be successful in the workplace. Sometimes that may be language needs for individuals and things like that. And so that was really the business why and what drove me into some of this work. Now it's obviously become a much more personal passion because I have had the opportunity to see a number of successful employees with very minor and low cost accommodations go on to huge successes, be able to get into gainful employment, and ultimately, the satisfaction of my organization being able to help them with that is very personal to me and something I take very personally. On a personal note, I have family members who have disabilities, and I believe that they deserve every opportunity to be successful as anybody else in this world. That's me in a nutshell.
Thank you, Kyle. I'm excited to hear later in this presentation how you're knocking down those barriers and some of the ideas you've had for accommodations that have helped with success. Dan, moving on to you, same thing. Would you be able to tell us a little bit about your organization, what's your connection, and then really your business why?
Absolutely. My name is Dan Talon. I'm a white male. I'm wearing a blue suit. I have a fiery ginger beard, and I'm also sitting in my office with a California plaque behind me. My pronouns are he and him. I'm currently the market director of human resources for Mercy One Central Iowa. So Mercy One is a statewide organization, and Mercy One Central Iowa represents the hospital systems within Des Moines, the surrounding area, Newton, Centerville, and a clinic system. So we have around 6,500 employees in this region. And so my introduction to specifically disability inclusion started when I was serving with the Department of Veterans Affairs, the VA hospital system, being a veteran and being aware of some of the disabilities that are not just ones individuals are born with or acquire, but they acquired through military service. there was a lot of opportunity to work with the VA voc rehab program. And specifically, while they focus on employment in the community, being able to take advantage of the voc rehab counselors and the programs that they had, training individuals that were veterans that were also the patients within the hospital, and helping them to find positions and employment within the hospital. So it was one that hit on the mission just in a couple different areas, both as a healthcare and a veterans organization. And so when I transitioned to the non-federal sector hospitals, had that opportunity to continue that. So through Iowa Voc Rehab Service, which provides quite a bit of service for organizations to place individuals with disabilities and to help break down those barriers that Kyle was mentioning, really utilizing their services and showing our leaders within the healthcare system that there is an opportunity and an untapped talent pool of individuals who want not just a job, but also a really good job. Healthcare jobs are ones that individuals can have for a lifetime and build an entire career in. And so really that connection from IVRS makes it simple. And that's something that I love to talk about. Healthcare is a fast-paced environment. Sometimes it's a very lean when it comes to human resources and other administrative functions, because all that focus is on patient care. And so organizations like IVRS are able to help us bridge that gap, are essential to actually being able to have an inclusive workplace.
Thank you, Dan. I'm, of course, really excited to hear more about how IVRS services help build that gap, and we're a resource to your leaders later in this presentation. Jordan, I'm moving on to you, and I'm really excited to hear about your role, your personal connection to the workplace, and again, your why.
Thank you very much for having me. My name is Jordan Butler. I am currently the campus talent strategist here at Quick Trip. Quick Trip is a convenience store chain with over 30,000 employees in Wisconsin, Minnesota, and Iowa. And my specific role, I work with our talent pipeline programs and creating awareness of our different career opportunities in the different communities that Quick Trip is in. So that brought me into helping with our retail helper program here at Quick Trip, which is a program for individuals with disabilities to come work in our retail stores. We currently have over 500 retail helpers, and over 70% of our stores have a retail helper. So it's a program that we started in 2013, and it was really a no-brainer from our leadership for creating this program. Our mission statement here at Quick Trip is to serve our customers and community more effectively by treating our customers, coworkers, and suppliers as we personally would like to be treated, and to make a difference in someone's lives. And so when the idea was brought up to leadership about creating this program to have opportunities for all in a community, it was a positive idea, and something that has been very exciting and very rewarding to be a part of. I'm a white female wearing a blue shirt and black headphones, and I'm sitting in front of a white board, and my pronouns are she, her.
Thank you, Jordan. I'm really excited to hear more about your Quick Trip Retail Helper program. Of course, it's one of our favorites. I love that over 500 stores have implemented this, being over 70% of the stores in the 3-state area. And so I think that's going to be really fun to hear about. Dan, I'd like to come back to you and have you share a time or what you're most proud of within your role of inclusion.
Absolutely. So I think I guess I'll go back to some of the first introduction of IVRS services into the first non-federal hospital I worked in, and really we were approached by IVRS. They had mentioned that they had tried to start a broader relationship before, and hadn't been able to to really move that partnership along and actually lead to employment. So honestly, the proudest moment that I could say is that first individual that we brought on through an IVRS partnership. And they mentioned that, of course, they had lots of individuals that they had helped attain employment in that hospital, at the last hospital that I worked in, but they had done so through the normal channel. So they hadn't yet been successful in bringing somebody on outside of that normal channel and being able to champion somebody to work in our environment that needed more than just a simple accommodation and who wasn't necessarily going to make it through the normal process. They required job carving, and so partnering with them to actually carve out a piece of the job that specifically met that individual's needs. It was very proud to see the work that IVRS does to champion an individual and also to bring a leader outside of the box, right? They think, here's my job description, here's the need, this is what I have to do in order to fill it. But being able to cut off just a sliver of that job from a whole work group and provide that to just one FTE and seeing that work successfully, I think was really proud. And then we actually use some of the on-the-job training programs through IVRS. So when that actually transitioned from that program to full employment, the entire work group was there to celebrate with the individual, was excited about it. So it wasn't just the manager that got an employee who was dedicated, but also the entire work group was dedicated to the program and really championing that individual's success. So.
Could I just follow up on a couple of things that you said, Dan? Would you mind explaining the on-the-job training for people who might not know what that is? And could you maybe talk a little bit more about when you talked about job carving, what that looked like and how it benefited your bottom line? Sometimes we hear, if I create a job for a person, it's going to cost me more money. And I know that Jordan will get into this a little bit as well as we're moving forward. But I think those are important things for our audience to hear.
Yeah, I'll start with job carving. Job carving is a fairly simple concept of, if you have A, B, and C that you require of an entire work group, but really you could chop off C or carve off C, which doesn't necessarily require the same skills or maybe the same mobility or same prerequisites as A and B. You could bring that over, and if you have enough C from enough individuals, you've got an entire job. And so it takes leaders to redesign their work. And I think in the challenge specifically within healthcare is that we are always a large organ. Even the smallest hospital is still, a large employer and sometimes the largest employer in their town. And the way things are done are sometimes just the way things are done. And so getting leaders to take that time and recognize that one, job carving is okay, that is appropriate because they are often told time and time again, we don't create positions for people, it's for the need, but really pointing out that it does fit the need and that it is appropriate. It's a really great